PRR or preventive resin restorations are natural extension of the use of occlusal sealants, that is the pit and fissure sealants. It is an alternative procedure used for restoring young permanent tooth that requires only minimal tooth preparation for caries removal, but also have adjacent susceptible fissures. The PRR, it integrates the preventive approach of the sealant therapy for caries susceptible pit and fissures with the therapeutic restoration of incipient caries lesion with a composite resin, and this occurs on the same occlusal surface. The indications of PRR are, the first one is an explorer catch in a pit and fissure, minimal pit and fissure caries, deep pit and fissure with supplemental anatomy and small area of decay, and a case of questionable caries. Simonson in 1978 classified PRR into 3 types based on the extent and the depth of the caries lesion, and he examined this with the exploratory preparation onto the tooth surface. So according to him, the 3 types are type A, type B, and type C. Type A involves suspicious pit and fissures where caries removal is limited to the enamel. Type B, incipient lesion in the dentin that is small and confined. Type C, where there is more extensive dentinal involvement which requires greater exploratory preparation into the dentin. So the first one, type A, here it does not involve the use of a local anesthetic agent since the caries is only limited to the enamel. Here, the preparation size is very small and it is done with the help of a slow speed small round burr of size 1/2 or less. Then it is followed by the application of an acid etching gel. Then we have to wait for some period around 20 seconds. Then it is washed and dried, which is followed by the placement of a sealant, and polymerization is done with the help of a light cure for 20 seconds. Finally, occlusal adjustment can be done to correct the bite of the patient if it is required. In type B, PRR, here also local anesthesia is not required. Here the incipient lesion in dentin is very small and it is confined. Here the removal of the caries lesion is done with the help of a size 2 round burr. Then an appropriate base is placed in an area of the dentinal exposure. That is, after caries removal, some amount of dentin will be exposed. So this dentin is sealed with the help of a suitable base material. And above this base material, a composite resin, usually it will be an unfilled composite resin, which is placed over this base material. And finally, the remaining pit and fissure will be sealed with the help of a sealant. So this is all about type B. Then coming to type C, there is more extensive involvement of the dentin. So this cavity may require a considerable amount of cavity preparation with a larger size round burr. Then local anesthesia may be needed since here there will be more amount of involvement of the dentin. So the patient may feel sensitivity. So to avoid that, local anesthesia is required. Then after cavity preparation, an appropriate base is placed onto the dentinal, and after that a posterior filled composite resin is placed above this base, and the remaining pit and fissures are filled with a sealant material. So this is about type A, type B, and type C PRR. So it is much more similar to a composite resin material or composite resin filling material. So similar to the composite restoration, here we have to do the acid etching followed by washing and drying, and then the sealant application is done, or the composite resin application is done on top of this. The advantages of preventive resin restorations are, first one is minimal cavity preparation. So since we are only minimally preparing the cavity on a tooth surface, we are only removing a small amount of the healthy tooth structure for the purpose of retention. So comparing PRR to an amalgam, conventional amalgam restoration, where mechanical retention is provided by extensive tooth preparation. Here, it requires only a small amount of cavity preparation. So, it is much more conservative in nature. The second one is, it may seal the caries. That is, it reduces the destruction of the tooth surface. That is, in a further date, when the caries lesion may involve the entire tooth surface, by sealing the susceptible pit and fissures at an earlier stage with PRR, we are sealing the caries. So, the caries may not involve the entire tooth surface on a later date. The loss of restoration and its subsequent replacement proves to be less invasive in this technique compared to the amalgam restoration, which involves the entire removal of the amalgam restoration. But in case of a PRR, and when the restoration is lost, we can remove the fractured fragment and the remaining can be restored with the material on a later date. So, it does not require the entire removal of the PRR. So, in conclusion, PRR can be considered as an excellent and minimally invasive treatment modality for restoring an young permanent teeth that requires only a minimal cavity preparation for the caries removal, and for long-term success of this preventive resin restoration, excellent isolation may be required so that moisture contamination will not occur. So, this will help to attain, or it will help to retain the material there.